All right, I arrive on scene. I see a male, looks like he's fallen while hiking. Before I approach the patient, I want to make sure my scene is safe. I'm going to apply BSI. I want to make sure there's no rocks or falling trees or anything like that that could injure me while I'm providing care to my patient or further injure the patient. So now that I've determined the scene is safe, I'll approach my patient. All right, so I want to look for mechanism of injury. Looks like the patient sustained a big fall, which would lead me to believe probably sustained some traumatic injuries. Come up to my patient and assess his level of responsiveness. Hi sir, can you hear me? Can you hear me? So he's not responsive to verbal stimuli, so I want to do a painful stimuli. Does he respond to that? All right. So my patient is responsive to painful stimuli. I want to start by assessing his airway, his breathing, his circulation. So, do I see chest rise?
You do.
All right. I want to make sure that his airway is open and clear, so I can open his mouth, make sure there's no teeth, any blood in his airway, anything like that might obstruct his airway. Next, I want to look at his breathing. I want to see if he has equal chest rise on each side, and then I don't see any difficulty with breathing. If his breathing is regular, I'll move on to circulation. Because he's painfully responsive, I want to assess his pulse at his carotid pulse. I feel that the patient has a pulse and it's a regular rate and a strong pulse. So now that I've assessed his ABCs, all are intact, I want to move on to my secondary assessment. If I had another care provider here, or if there was a bystander outseen, I would direct them to take manual stabilization of his spine. I'll start by assessing his head. I want to feel around the top, see if I feel any fractures, depressions, any blood on the surface of his skull, anything like that. If I don't see that, I'll move to his ears. I want to look to see if I have any fluid coming out of the ears, any bruising behind the ears on either side. At that point, I can come down, feel the back of his neck. If I don't feel any pain there, move on to his forehead, come around his eyes. I want to see if I feel any bone fragments, see any bruising, seeing any bleeding. I can then look at his nose, see if there's blood in his nose. I can open his mouth, see if all of his teeth are in the same place, if they're intact. See if there's any blood in his mouth, make sure he still has an open airway. Next, I'm going to come down to his chest and expose his chest. Take off all of his clothes on his upper half. All right. I'm going to start at his shoulder. See if I elicit any pain. All right. And now that I've exposed his chest, I do see bruising and a hematoma on this side. So I'm going to assess coming in. I'm going to feel and look for any flail segments, any crepitus, anything that moves paradoxically when he's breathing, and make sure that his respirations are equal on each side. Next, I'll move down to his abdomen, feeling all four quadrants, checking for any rigidity, tenderness, or painful response. Next, I'll move into his upper extremities. I want big wide hands, cover the surface area of his whole arm. So at this point in my assessment, I'm noting injury on the left side of his chest. Move down to his hips. I'll squeeze in and up. If I don't feel any crepitus or get a painful response with that, I can come down from the top. And once again with big wide hands, feel his entire leg. See if I feel any crepitus, feel any blood, or elicit any painful response. All right. At this point, I would take a set of vital signs. Once again, I want to get a pulse, his carotid pulse, get a respiratory level, or respiratory rate, and quality for each of those. And at this point, due to his mechanism of injury and serious injuries, I want to activate a search and rescue team or more medical care providers to help extricate him and get him to a hospital.